So we can imagine that health is kind of like a stick balanced on the ground. And as someone becomes unhealthy, their balance starts to get off a little bit. And to resolve that, we want to push them back up to center. So we want to use something with an equal push to bring them back. That's supposed to be equal. Again, bad artist. As we get further and further away from the center, so if someone's all the way down here, we're going to need very strong herbs to get them back to the center. There's a little bit of a self-righting capability. So, you know, if we end up pushing the person a little bit off, it's easy to bring them back. And this right here is kind of the cool to warm matrix. It's wiggling back and forth around the center. To a certain degree, you're limited on how much you can hurt someone temperature-wise, as long as you're in this range. These are, most of our safe herbs are going to be in that temperature range. Once you start leaving that temperature range, one of the things that they're saying is cold and hot herbs have the ability to cause damage. In general, with the cold herbs, we're concerned about causing damage to the spleen and stomach, right, to the digestive system. But then after that, we're worried about causing damage to the person's Huang Qi. The hot herbs, we're mostly worried about damaging the yin and about damaging the blood. So here, damages Qi and Yang. And over here, damages blood and yin. And as a subset of the Qi, that would also be the spleen, stomach. So when we say an herb is cold, that doesn't mean that we can take its temperature. That doesn't mean we can put it on some sort of a scale that can tell us objectively what its temperature is. None of these are supposed to be objective statements about anything that has anything to do with a temperature. What they're telling us is a warm herb is fairly safe and can be used fairly generally without too much concern about the patient, at least in terms of temperature. There are other factors. But once they're telling us an herb is hot or an herb is cold, they're saying, make sure you need this. Because if you give a cold herb to a cold patient, you can cause real damage. And if you give a hot herb to a hot patient, you can cause real damage. So when they say an herb is slightly cold, what they're saying is, pay attention. Make sure you know what you're doing here. When they say an herb is slightly cool, they're saying this herb is really not going to be a problem for the vast majority of patients in terms of temperature. When they say cool, they say, yeah, make sure they're not already cold, but not that big of a deal. In terms of temperature, the extremes are telling you when you should be concerned and how strong of an effect they're going to have. Now that also goes to say, using this tilting pole example, if they're all the way tilted over here, giving them this little push that brings them back up to this isn't going to do anything. They're still falling over. If we need to bring them all the way back up, we do need hot herbs. I personally think we have an issue of some people who take herbs seriously become concerned about using herbs like futsa when they really should use them. And some people who don't take herbs seriously use futsa when they shouldn't. So if you are serious about getting good with herbs, especially when you're in the clinic and working with a supervisor, start asking them, can we use futsa with this cold patient? Can we use rogueway? Can we use the hot herbs? It's their job to tell you no, if that's the case. But you're not going to learn how to use the herbs that are situationally dangerous and situationally wildly effective if you don't practice them. So try to use cold and hot herbs in the clinic, run them by your supervisors, see what they say. But this is basically telling you how concerned should you be about the herb. The other piece of this, does that make sense so far? You guys with me? Okay. So, because we don't have very cool and very warm. It's not really a thing. It switches over to slightly cold. The other thing that they're telling us here is how easily can you modify the herb? Because remember, we don't use these herbs by themselves. We use them in formulas. So if we have 3 warm herbs in a formula and we want the herb to be and we want the formula to be too warming, we can balance it out with cool herbs. There's our balance. If we've got a bunch of hot herbs in a formula and a bunch of cold herbs in a formula, let's make these notations better. A bunch of cold herbs in a formula. When these come together, they're much more likely to just cause chaos and not play well together at all. They don't balance each other out in the same way. For example, putting Sichuan peppers on watermelon doesn't create a neutral flavor. You're going to be simultaneously cooled and burned. In this case, cold and hot, hard to modify. If you want a cool formula, you can put warming herbs in it. That's doable. It just overall has to be over here. So you can balance the herbs out, and you can shift and you can play. This whole area has some flexibility to it. These, much less flexible. Does that make sense? So
yeah, because I guess you wouldn't like, there isn't really a situation where there would be a hot and cold together, because the patient would be cold, so you'd be in like the warm, hot, neutral, like you'd be trying to pull them, so the formula would be probably more on the hot, warm side of the spectrum, right? With the herbs in the formula, more typically.
Well, there are some complex conditions where we have things like mixed hot and cold pathogens in the intestines, which can be certain types of irritable bowel syndrome where you have like alternating, sorry for the grossness, alternating pus and diarrhea. This can be Crohn's disease in some patients where it's like stabbing pain, and then also occult bleeding in the stool, where you see the heat manifesting as the bleeding and you see the cold manifesting as the cramping pain. Often these people switch between like completely dry, rock hard stools and watery diarrhea, like even within the same day. So you see this patient, you're like, I don't know what to do here. Sometimes we will use hot and cold herbs to treat this sort of thing at the same time, but we use them to purge it out. We're not trying to resolve this. We're trying to make them poop and get it out. And using both of these at the same time and causing a little bit of chaos through here to get that expulsion can be acceptable. But if someone has like heat and, I mean, you don't really have conditions where you have heat and cold in the liver simultaneously, but if you had that, you'd have to figure out which one to do first, by and large. Does that make some sense?
Yeah, is it more like when you treat, do you think of it as like layers? Like that's something I heard in clinic where, you know, where we do some like Shaoyang first, you know, like there would typically be some like clearing to do on the surface before you could actually treat whatever the internal kind of pattern would be.
Yeah, I very generally will see patients as being a little bit onion-like. And I generally don't prescribe herbs for the first handful of treatments with somebody, because the first handful of treatments are usually getting through some of these outer layers, even just in terms of what they're telling me about what's going on with them. So I've had patients who show up and, you know, day one, their chief complaint is shoulder pain. Week 4, their chief complaint is suicidal depression that they never mentioned in the first few weeks. It's like, well, if I started treating them for their shoulder pain and was mistaken that this outer layer was the reality, we never would have gotten to this interior part. So very often we're waiting to get here. And then once you get to the real problem, yeah, you might spend 3 weeks clearing out damp heat. And then when that's gone, all of a sudden something else is there underneath and you go, oh, that makes so much sense. But now we have to completely rethink how we're doing this. But it's rare that you're going to go like cold and then hot and then cold and then hot. It tends to be something more like damp heat in the liver. And then as you're resolving that, you start noticing that there's also like just damp cold in the lower jiao, let's say. And then as you're clearing that out, you start noticing that there's also a lot of phlegm in the intestines. And so you can go through these processes, and then you might end up back here up at the damp heat of the liver, because now all of a sudden that's the most important thing to work with after you've cleared this other stuff. So it can go in layers. The layers don't necessarily work in a logical linear sense all of the time, but don't let that concern you. That's Chinese medicine doesn't work in a linear sense either, so they go well together. Does this description kind of explain the temperature range here and what you should take away from these things?
Yeah, it does. It's helpful.
Cool. Any other questions?
Yeah, I'm not sure. Honestly, I'm not sure I understood the slightly thing, like slightly bitter.
Sure.
I didn't get it.
Yeah, I mean, all they're saying when they say slightly is, so let's do this. Slightly means less so. So when we say slightly bitter, it's just less bitter than we would expect from a bitter herb, which means more flexible in its usage or more broadly applicable. But also probably weaker. That make sense?
Yeah, so it's like, let's say it's still bitter, but it's just like, I get it, more flexible to work with it, like in different formulas, I guess.
Yeah.
Okay.
So let's take, for example, we might see a patient with a weak spleen and stomach, weak spleen qi, weak stomach yang, weak stomach fire. So we don't want to give them cold herbs because the cold is going to put out the fire. At the same time, we also probably don't want to give them anything that's very bitter because that drains downwards, right? So if the spleen is trying to lift upwards and the spleen is weak, we don't want things that move down very strongly, or else they might get diarrhea anyways, right? Even if it's a warm bitter herb, we still might not want it. On the other hand, so just put that there for now. On the other hand, something that's slightly bitter is only going to go downwards a little bit. And if it's only going downwards a little bit, well, then we can add in something like shengma or gagun, or anyone want to mention the third herb?
Chaihu.
Chaihu, an herb that has a upward tropism, or one of our go-to favorites. Anyone remember this herb from Intro to Herbs that moves upward strongly and tonifies qi? Astragalus? Did you guys not learn this? Huang Qi.
That's what you said, yeah.
So Huang Qi moves upward strongly. If we're concerned that a formula is moving downwards too much and we want some level of tonification, we might include something like Huang Qi to resolve that issue. But if the herb is very bitter, like, you know, just to make these words similar, Huang Qin or Huang Lian or Da Huang, any of these which move down quite strongly, this doesn't mix well. Or at least you have to be careful about how you do it. There are formulas where you use these together, but I don't think there's any where you do that. Okay, I'm in a mess of this whiteboard. Has this made sense?
It does, it does.
Good.
The thing is, like, in addition to this, so instead of using, like, let's say slightly cold, can I use cool, or it's like completely different temperature?
Well, it's not, I mean, it's not completely different in its functionality, but like, let's do this. And we're gonna have to move on in just a minute because we do have a bit to cover today. Let's say we have 100 grams of a cool herb or 10 grams of a cold herb. Most of the time, I'm sure we can find exceptions, but most of the time, this is going to have a stronger effect in terms of cooling the person down. This isn't something where you can just go, oh, a lot of cool is cold. It's a little bit different. Something that's slightly cold is going to fall somewhere in between the two. So you need to choose the correct temperature of herbs for the patient. That's basically the answer. And cool and cold, they're similar. They're in the same vein. They're the closest of the temperatures, just as, well, equally as close as warm and hot. But that doesn't mean that just more cool makes cold. Depends on the herbs. And then you've got to take into question, like, is this up or down? Is this in or out? There are other factors to take into account. But again, you don't really have to worry about this too much because you're not making formulas for another 2 years. Not from scratch. And a big part of what you're going to learn when you learn all the formulas is go through these classic formulas and get taught why were they built this way. So you're going to learn formulas and you're going to go, well, why don't we just substitute Ma Huang for this other herb? And the answer is going to be, well, the temperature, or we need something that's fully bitter, not slightly bitter. Okay. Everyone doing all right? Okay. You feel free to email me if you're having any problems here. I'm happy to spend some more time on this. That being said, this stuff is hard. Let me clean up my computer for 1 second here. Oh, you know what? Let me send that over. This might be of interest to some of you. I don't know if anyone here has taken raw herbs much. Let's see why I shouldn't share this. Putting a PDF in the chat of how to use a thermos to cook raw herbs. It makes cooking raw herbs a lot easier, especially if you have roommates who don't like your house smelling like Chinatown. Okay. So I think the last herb we covered was Jutsu. Is that right? Yeah?
Yep.
Great. All right, so we just started on the clear heat drain fire category. Herbs are cool to cold, lots of bitter, quite a bit of sweet, which as we're gonna see moving forward has a lot to do with fluids in some of these herbs. Since we're talking about fire, we're talking about liver, lung, stomach, and heart. Stomach fire is an interesting thing because we need fire in the stomach, but when it starts getting out of control, we often see mental and emotional disorders arising. So the treatment of stomach fire is one of the interesting places that TCM psychology goes. Talked about Shigao and Zhumu working together in part to clear out stomach fire, stomach channel fire. And then we went into Jutsu, and I spent a little bit of time talking about how I love this herb, in part due to its function for treating urinary tract infections. And we're going to be talking about some other herbs that play well with Jutsu here. So Jutsu often plays chief. Jutsu can carry a formula. Danjuye cannot. Danjuye is a wonderful herb, but it's not a chief. It needs someone else to play the big role, and then it comes in as a deputy or as an assistant to help. And given that it goes to the heart and the small intestine and promotes urination, we can guess from that that it's going to go well with Jutsu for clearing out heat from the heart. So Jutsu will get the heat out of the heart. Danjuye will carry that to the small intestine. And then we're basically we're most of the way to urinating that out. So one of the things that this gets used for, you'll see the phrase in Bensky, painful urinary dribbling. One of the things that painful urinary dribbling can be is a urinary tract infection, where painful urination, which is often incomplete or difficult to do in the first place, is a major symptom. So most of the time when you see the phrase painful urinary dribbling, we're talking about urinary tract infections, or any other time where painful urination would occur. Sometimes we're talking about benign prostatic hyperplasia, for example. pretty straightforward. This is really the main thing we use it for, the heart to the small intestine, getting that pathway open to get heat out of the body. It's very good at getting damp heat out because it's promoting urination. You'll see promoting urination come with damp draining herbs all the time. In fact, when we get to some of the damp draining herbs later in the semester, this is going to be a common thing to see. So this is the first herb we're talking about today, but we've already done a lot. Why don't you guys take 10 minutes now, just breathe and like shake off the quiz, shake off some of this other information, and let's come back at 7:15, okay? That work for you? Sorry, I turned into an Energizer bunny about this stuff, but I remember being a student and being like, he needs to stop talking. So I'll see you guys in 10 minutes, and have a good break.
Thank you.
Yeah, for sure. Okay, are people ready? All right. So we're just wrapping up with Danjie. Good question, Leela. So bland means a number of different things. The main thing it means is that it promotes urination. Pretty much every herb that's bland is going to promote urination. Second to that, it usually means it's pretty easy on the spleen and stomach. The spleen likes blandness. There are actually bland diets based completely around eating bland food to help the spleen and stomach to become stronger and healthier. A lot of traditional congee recipes for people who are convalescing would be called sweet and bland. So we would consider a lack of flavor that often comes with, it's not quite a lack of flavor. Blandness has a quality to it. It's almost like a mildly chalky, slightly drying flavor. Fu Ling is extremely bland, which is one of the herbs I think you guys learned in Intro to Herbs. There are a number of traditional diets that involve eating bland foods for spiritual reasons. So a lot of traditional fasts involve having nothing but very bland and simple soups. The La Dieta, the diet that's used before taking ayahuasca, involves eating nothing but bland food. You see this in a number of different places. And part of the idea, just going to spend a second on this, is that so the spleen is in charge of transformation and transportation in the body. If the spleen is strong and is not being weakened by what you're eating, but it's also not being burdened. So if you're eating food that nourishes the spleen and your spleen is strong and the food you're eating is not putting a lot of burden on the spleen, then the spleen has the ability to transform and transport other things in the body. This is one of the ways we think of detoxing within Chinese medicine. Enable the body to do its job and don't burden the organs of digestion. And the organs of digestion will digest that which must be digested that's residue in your system. It allows kind of that extra energy to go to be a cleaning crew. And we often want to promote urination because we see urination as one of the best ways to get heat and dampness out of the body, which are two of the things we worry about the most long term. Does that make sense? So bland is a flavor as well. Kind of an extra quality that's slippery, cloying, but we'll include it with the flavors.
Peter, can you say that last point again about frequent urination and the importance of it?
Yeah, so anyone who's trying to do a detox but isn't also drinking massive amounts of water is doing it wrong, because you need a vector to get these things literally out of your system. And Chinese medicine likes using the urine as a way of getting things out of the system. Again, if you go down to South America and you work with someone who does something like campo medicine, the poison dart frog put into burns on the skin, they're going to use vomiting as the way to get stuff out of the body. But even before that, you drink a gallon of water. There are systems that are going to use defecation to get it out of the body. This is one of the ideas in like the temazcals in Central America or in saunas in Northern Europe, where you're going to get this out through sweating. But there has to be a mechanism of getting it out of the body, and it always involves water. So if you're not hydrating and you're trying to clear things out, it's not going to work. And so we want things that promote urination so that you don't just retain this water. You want the water flowing through. And actually, in just a minute, we're going to talk about one of the best herbs for this in this category, or an herb that both promotes urination and generates fluids within the body. So it allows you to clear out the old fluids and bring in new fluids in one herb. Yeah, so promoting urine and clearing damp heat, what they're saying here is that the damp heat goes out through the urine. That's what they're saying. If it said promotes bowel movements and clears damp heat, they'd be telling you that you're going to be pooping that damp heat out. If it said promotes emesis, promotes vomiting and clears damp heat, they'd be telling you that you're vomiting it out. The damp heat doesn't disappear on its own. If they say drains, they just mean it's getting down towards the urine. It means it's moving down the jowls. If it drains damp heat and promotes urination, it's telling you it's going to move downwards and out to the urine. Okay, so I think that's a fairly thorough description. So when we look at Jutsu, it's going to drain heat. We then take that drained heat and we pass it over here to promote urination and clear damp heat. So the two are going to work together nicely. So we have a bunch of herbs that on their own will get pathology unstuck from an organ or from a channel, and then we use another herb to get it all the way out of the system. And we combine them together because we don't use herbs by themselves. And if this sounds complicated, it's actually a lot easier to learn than it sounds like. If that feels overwhelming, to think about all these herbs combining when you get to formulas, we figured out how to teach this. It's not as bad as it sounds. Okay, a couple of things to note about Danjuye. This is one of the reasons why it's always, well, not always, but often interesting to read the commentaries, or not, yeah, the commentaries in this case. Danjuye, historical note. Traditionally, this was bamboo. Traditionally, Danjuye referred to common bamboo leaves. Bamboo itself is not used as medicine within Chinese medicine, but the leaves were. Sometimes the roots were, but the actual stalk wasn't. These days, it's a somewhat similar plant, but no longer bamboo. But every now and then, you'll hear people refer to Danjuye as bamboo. And while they're technically wrong, they're also kind of historically accurate. Okay. Shigua is a real easy one. It's watermelon. That's it. Easy to remember. Cools, moistens, facilitates urination. And this is, let me get us off of, actually, I want something from here, so 1 second. Main function, clears summer heat, generates fluids. Where should you eat watermelon and in what season? Anyone here, when you think of people who eat watermelon, what part of the country are you thinking about?
South.
The South. And what season are they doing it in? Is it hot or is it cold out?
Hot. Summer.
There you go. That's when you're supposed to eat watermelon. You're supposed to eat watermelon when it's hot enough out and humid enough out that your sweat doesn't evaporate and you start to overheat. When that happens, you want something that generates fluids and promotes urination, and that's what watermelon does. Watermelon doesn't do it very well. It does it, but it doesn't do it very well, which is often why you need to eat a lot of watermelon. If you notice here, the dosage is 15 to 30 grams. That's not actually that much watermelon, but in a dried form, it's more. Promotes urination and expels jaundice. It gets the heat out of you. The jaundice in this case is just heat in the liver. We're not talking about someone full on yellow. We're talking like minor yellowing of the whites of the eyes and maybe a little bit of yellowing at the borders of their skin. But that's it. It'll help get that out. This isn't for hepatitis. It's not for hepatitis jaundice. It's just for overheating and not getting the heat out. That's all well and good, but there's one more thing that's worth pointing out, because we don't really use Shigua very much in clinical practice, but we do use the emerald raiment of watermelon, which is a very fancy way of saying the outermost layer before you're on the outside of the skin. So not the white part that's bordering on the green. So if you look at watermelon, right, like kind of triangle shaped, it's red most of the way down, then you've got a white layer, and then it starts getting green again. The white to green part of it that we generally don't eat because it's no longer sweet is the best part for getting heat out of the system. So if you find yourself in the South and eating watermelon, eat all the way to the rind. It's colder and more effective. Otherwise, as you can see in the lack of commentary and lack of stuff written about this, we don't really use a ton of it. It can be used, according to the Essentials of Materia Medica, to treat hangovers as well. That's about it.
It's a good use case, right? It's a good use case.
Yep. There you go. All right. Our next herb is Shakutsal from Nelespeka. So these are, you know how Jingjie kind of has a bunch of frondy bits to it? Let's see if I can get an image of this. A couple things up on chat here. Yep, true. Tropical island, yep.
I just had a quick question about the, is it Jigua, before we move on? So then the pink or the red part, if like the real, I mean, to get the damp out, to get below that is really kind of the point. When you're eating the pink or red part, like what is that actually doing? I mean, I'm sure it's giving you some points, but. So
the pink and the red parts are going to do all of these things. We're actually talking about the pink and the red parts for this herb. Clears summer heat and generates fluids, promotes urination, expels jaundice. When you get to the edge of the plant, of the fruit, it gets much stronger at the promoting urination and clearing summer heat, and it gets less good at generating fluids. It gets less sweet, and it begins to get a little bit bland, which you can see here. It says that it's sweet, bland, and cold in the commentary. Well, you got to get through the sweet part to get to the bland part. So the outside part is more draining, and the fruit is more, generates fluids more.
Okay, cool, thank you.
So you eat both. Like, you know, if we're talking about this as food and there's a summer heat issue, you want to eat both. If we're talking about what you might want to have in your clinic as something to prescribe to patients, you can probably get away with just the white part of it.
Okay, and if someone already has a lot of damp, if someone has like what would be the opposite of who should be having this is what I'm trying to understand. Like
someone with cold diarrhea.
Okay, and then they're eating this, okay. Thank you.
So the concern with watermelon is that it's cold and then it directs downwards. So anyone who's already cold, someone who doesn't have an appetite, someone who tends to be kind of weepy, someone with a cold pulse, someone who doesn't have fire in like a fiery kid, this might be good for. Someone who's already kind of lethargic, this is probably less good for. Yeah, lack of heat.
Oh, thanks.
Okay. So Shakutsal is an interesting looking herb. This is one that sometimes people think, oh, is someone holding it up there? Yeah, hey, all right, let's spotlight Marianne for a second here. Yeah, so one of the issues people sometimes, thank you, Marianne, sometimes people run into problems thinking that Shakutsal is just dry Jingjie. So keep that in mind as, how do I unspotlight this? Okay. So keep, oh, no, it's just both of us. Somehow I'm still figuring this out. It's only been 2 semesters. There we go. All right, so keep this in mind. Shakutsal kind of looks like dry brown Jingjie, which can make it confusing on herb IDs. Marianne's mentioned she takes it in combination with other herbs for hypertension. Yep, that's one of the things that it's used for these days. Let's go a little bit deeper into how it works and what sort of hypertension we'd be looking at with this. It is a common hypertension herb. There we go. Okay. So clears liver fire and brightens the eyes. Clears heat, dissipates nodules, and listed in Bensky, used for hypertension. This is one of our go-to herbs for heat in the liver and gallbladder, especially if it also comes with stagnation and fluid physiology issues. So if a person has hypertension and also tends to get any sort of swelling anywhere in their body, any sort of weird movement of fluids, if they start getting phlegm in their lungs, if they start getting sinus congestion that seems to go with the hypertension, then we're looking at Shakutsal for a lot of this. Let's go a little bit deeper to look at why. We drink a lot of this in the summer along with monk fruit and honeysuckle, if that fits. I don't remember what monk fruit does off the top of my head, but the honeysuckle has a somewhat similar function to Juhua, except a little more tonified. Let's take a look at Bensky for the next part of Shakutsal. So, yeah. It has a cooling and dispersing function, and so it's used for clumped stagnation, such as phlegm thickened by heat. We're beginning to get into the herbs that might be used for people who have, fluid problems due to heat cooking down the fluids. So this could be someone who's coming in whose chief complaint is that when they get angry, they start coughing, and then they get phlegm stuck in their chest, and they're trying to cough it up for a few days. That can be an example of this. There's some debate about it. Some classical people think that it also has a tonic function, but we don't really use it for that anymore. But we do use it for phlegm, for nodules. You'll see some patients at some point in your career who will have things like fatty deposits that frequently show up under their skin. Like nothing really, in a Western sense, pathological. It's not cancer or anything like that. They just get these nodules. This is one of the herbs we're going to use to dissipate nodules. They're here talking about scrofula and swollen glands or goiter, but what we're looking at is lipoma. And in this case, we're looking at lipomas that are due ultimately to liver and gallbladder fire. That's Shakutsal. Also benefits the eyes. Keep that in mind. Yeah, good herb. Good herb. Used creatively. Has a lot of flexibility. It is still cold, so you need to be careful with it. It can still hurt people's digestion, but in general, good herb. Yeah, there's some notes in here about how it works with the eye, how it connects to the Jue Yin. As with most of these things, I'd recommend reading up a little bit more. Is there a question?
I thought we said that salty is like sort of dissipate noodles, but I see if it get to the Jue Yin, it makes sense why it's dissipate noodles.
Yeah. So what salty tends to do, one of the functions of salty is softening hardness. That's the phrase that we use. And the salty substances almost work like sandpaper, like taking layers off of things. So we'll use some salty herbs, formulas that, topical formulas that treat things like bone spurs are very salty. In this case, the combination of bitter and acrid has a dispersing function. So we're not looking at things that are very hard. We're just looking at these kind of like fatty, phlegmy things. But again, it's only for a specific reason. This isn't something that you're going to give to a patient who has lung fire, who's developed phlegm in the lungs. This is for people whose free flow of qi has been interrupted due to fire affecting the liver and gallbladder, resulting in drying up of fluids and accumulation. So it's a specific case. So this isn't, don't make a lipoma formula and put Shakutsal as the main ingredient because it's only for some manifestations of it. And I want to keep bringing this back to the properties and the channels tell you which cases these things work for and which ones they don't. So if the patient's hypertensive because they have yin deficiency, so a menopausal woman who gets hypertension due to yin deficiency and deficient heat, but no excess fire, who takes Shakutsal will begin, it will lower her blood pressure, but she will get side effects specifically related to things like low back, energy levels. It will drain things that shouldn't be drained. Does that make sense? Do you guys understand that? Okay. Lanzachine. So when you see Lanzachine, when you see Lanzachine, I want you to think Sheen. I want you to think heart. That's what this is for. We use this herb to drain heart fire. That's its function. Yeah, we use it to stop bleeding and bind the essence. There's a few formulas that's in for that, but you just use those formulas. You don't really have to memorize this herb for that function, though There might be some, you do have to for this class and for board exams, but in your head, I want you to really remember this as an herb for draining heart fire. Someone want to give me, I mean, I've got stuff up here right now. Heat in the heart and pericardium causing mental confusion or delirium. Would someone here want to take a guess as to what that looks like that is not insomnia or irritability? Common mental emotional disorder that people suffer from.
Schizophrenia?
Could actually be schizophrenia, but I'm going to go for a more common one first here.
Okay.
Not a wrong answer though. This is used for mania.
Oh.
This is used for manic episodes, manic people. So if you have I have a patient I'm treating recently who is bipolar, who's well medicated, but tends to still go from like normal to hypomanic and kind of bounce back and forth right in that region. And one of the things they're concerned about is passing from that hypomania into the sort of mania where they're going out and putting deposits on cars, right? Like that like just irrational decision-making mania. And one of the things I gave them was a formula which contains lianzashine with if you start feeling that boundary getting crossed, you take this formula. Just keep it with you. Keep it on your medicine cabinet shelf. Try to keep you right in that range that works. That's a branch treatment, but it's a good thing to have available because we don't have a lot of things that treat mania that aren't also either depressants or narcoleptics or make people sleepy, basically. So good herb, really mostly one function, low dose. And also pretty. Anyone here has this herb with them? It's kind of a pretty herb.
Hey, Peter.
Yeah, we got a couple people holding it up. Yeah.
For that one, because it's a cold herb, is your patient hot, so it's okay? Or is it just because they're taking it here and there, it's okay?
Yeah, this patient has some kind of long-standing heart-kidney related issues, but they have excess heat. In this case, they're also in recovery from years of alcohol and drug use, and they've got a lot of lodged heat pathogens in their system. So I'm not particularly worried about cooling them off too much. And the dose isn't very high. It says it's cold, but it's not cold in a way that I find particularly damaging to the spleen and stomach if it's combined properly. I would not want them taking the formula I gave them 3 times a day every day, but if they're taking it 3 times a week, I'm not worried. It's no worse than a couple spoonfuls of ice cream. Like, not great, but it's not a pint a night.
Okay.
Yeah, good question though, thank you. Okay, we're now back to one of my favorite herbs, lugun. Phragmitis rhizoma. Phragmitis, I think fragmented, and this herb is hollow. So this is the stem or the root stem of a reed-like plant. You can see that. Ugh. Skip some ways that don't help. And this is the herb I mentioned a little while ago that has the dual function. So first, it goes to the lungs and the stomach, and it's sweet and cold. Not bitter, not acrid, just sweet and cold. The coldness is going to drain down a little bit. The sweetness is going to tonify. And in this case, I don't really like how they've ordered the indications because what we care about is that it generates fluids and it promotes urination at the same time. So this cycles your patient's fluids out. If your patient has dampness and dryness present in different parts of their body, this is a great herb, if there's also heat involved. This is, still a little bit complex for where you guys are at in terms of your theoretical education, but if you have, let's see here, do I have the right information on this page? I think I'm just gonna have to say this. If a patient has a lack of fluids in the lung and stomach and damage to yin in the lungs and stomach and heat in the lungs and stomach, this is one of our go-to herbs. Can anyone think of a common medical condition where you have lung and stomach yin deficiency, very frequently, and damage to fluids in both of those organs and heat present? Again, I think this might be a little bit more complex than you guys are really at right now.
Menopause? Menopause?
Menopause is close. We're looking more at liver and kidney yin deficiency in that case, but you're in the ballpark.
Diabetes?
Diabetes. This is one of our key diabetes herbs.
So this is like upper jiao, wasting and thirsting in particular?
Upper and middle,
Okay.
lung and stomach. So as we can see here in the commentary, this is used for wasting and thirsting with heat. So one of the hallmarks of diabetes is frequent clear urination. And so because the person will drink water, it'll pass right through them and they'll stay dry. They don't absorb it well. So what this does is it clears heat and promotes urination. Often it will darken the urine for these patients with clear urination. The dark urine is a sign that there's heat present. If a patient has heat present and clear urine, it means the heat is not getting out through the urine. One of the things we expect to see when we begin clearing heat is for their urine to get darker. I've been seeing this for myself recently. I've been taking a formula called Wupisan, which involves the peels of 5 different plants, because I've still, from an injury to my leg at the beginning of the year, I've still got some edema in that leg. And this formula is for superficial edema with heat in the lower body. Once I started taking it, the edema has gone down and my urine has gotten much darker. It's because that's what happens when you begin getting the heat out. Yeah, so in this case, it'll help get that heat out of the diabetic patient while generating fluids and beginning to support the functioning of these organs. It says it's sweet. I don't think there's any sugar in this. It doesn't taste sweet. So it's not something I'm concerned about giving to a diabetic. There are other herbs that are a little bit on the fence that we use for diabetes where it's like, there's not no sugar in this, but it's a small enough amount we don't really worry. And then there's other herbs like honey, which moisten the lungs and the stomach, but it's too sweet. We just can't use that with diabetics, despite the fact that it gives some brief symptomatic relief. I would read through the commentary on this one because they are going to talk a little bit about how diabetes works, and they're going to go into a little bit more detail about how this herb works. One of the things to keep in mind when you read the commentary on these herbs is that we argue about these things. Just memorize the stuff that's given at the beginning. And if in the commentary it says, no, the herb's actually bitter, just remember that there's been debate and some people have thought that it's bitter, but don't put it on an exam. I love this herb. It's a really good herb. Okay. And it actually goes nicely with Tianhua Fun, our next herb. How are we doing on time? Okay, so we got about half an hour here. After we finish this herb, we're just going to take a 5-minute break and then finish up this section. Tianhua Fun, Trichosanthis radix. This is one of our main ex-smoker herbs. Some people have asked questions about some of the other herbs that work with heat or phlegm in the lungs of like, is this something you would give to someone who has a smoker's cough or an ex-smoker? And now we're getting to the ones that do that. So looking at this combo right here, cools heat, generates fluid, resolves toxicity, reduces swelling, and moves the blood in the lungs and the stomach. Drains heat, generates fluid. And here's the key that tells you that this is going to be good for smokers. Used when heat injures the fluids. When the person's smoking, they're consistently bringing in heat and toxicity into the lungs. The phlegm shows up because the heat cooks the fluids down and the toxicity makes it hot. That's your combo. So here you start to get this heat damaging the fluids, giving rise to thirst and irritability. We also use this herb for some diabetics sometimes because it also treats thirst from yin deficiency and wasting and thirsting disorder. This is also one of our go-to herbs this herb is also going to be included in formulas to support people who are going through chemotherapy for lung cancer, because it helps with all sorts of different phlegm and blood and heat issues in the lungs. So really, it's a pretty cool herb. And we're basically going to repeat that over and over now. So clears and drains lung heat, transforms phlegm, moistens lung dryness. That's our smoker again. They've got the phlegm in the lungs, yet they have it's like a dry, phlegmy cough that you tend to run into. So you need to moisten the dryness, but you also have to get rid of the phlegm. This herb does both of those things, especially when heat has led, for phlegm above the diaphragm, especially when heat has led to dryness, that's smoking. And then here are a couple of ways that we would combine it with other herbs, depending on how that presents. And it's also going to be useful if, so sometimes smokers get things like walking pneumonia, or they start coughing up phlegm that has a greenish tint to it. This has a certain degree of stopping toxicity as well. So we're going to use it in those circumstances. Yeah, Kyria, what's up?
With the smokers thing, I just have a couple of really dear people that are smokers, but with somebody who like is taking herbs like this and actively being a smoker, like a cigarette smoker or a pot smoker. So how would that work? Like taking herbs and then still like reintroducing that.
Yeah. So the very short answer is make sure you're not prescribing these herbs to people in your life yet, because all of these have potential dangers. The slightly longer answer is we are going to treat it differently if they're still exposing themselves. So let's get rid of the smoking, where there's a certain amount of morality involved in that, and let's switch this instead to what would we give to someone who fights fires in California, where you're still getting this sort of toxic exposure to heat and smoke, but we've removed the whole question of whether or not of this being their choice or whatever. In that sort of situation, we want to be really careful in our balance of removing phlegm, which can be drying, with generating fluids that can be moistening and protective. We want to walk this line of getting out the toxic stuff that's in there, while at the same time making sure that we're not causing damage while we do that. And if they're consistently getting more of this damaging material into their lungs, then it changes our rubric, and it's going to depend on the person. It's going to change our math of how we're combining herbs. The short answer is we're still going to be cooling and generating fluids, but this is not an herb we use forever, because all of these are going to be damaging the spleen and the stomach. So it's coming at costs in other parts of the person's body. If we're consistently cooling, generating fluids, and getting phlegm out of the lungs, then we're also going to be causing damage in some other places. So I tend to recommend that they use dietary therapy if they're doing this in an ongoing way. And things like, there's a whole bunch of foods, including frequently eating pears or even making pear tea, that can be useful for gently moistening the lungs without causing damage. And then we might look at some of these things in a low dosage, used continuously for an extended period of time.
Oh wow, thanks for that. My husband's actually a firefighter, and does a lot of like woodworking stuff. There's a lot of chemicals and toxicity coming in constantly.
Yep.
Yeah, so this is helpful.
Yep, Shinigong's got it right here. Pear and snow fungus stew. That sounds perfect for this sort of thing. And yeah, I mean, so there are answers, but you have to be careful, because there are ways in which we treat things when we're trying to finish treating them and cure something that's very different than if we're going to be addressing it in an ongoing manner for years. And so for someone like a firefighter, I don't think I have it here on my computer, and getting a little bit behind here, but there are some herbal formulas that have been floating around the internet, or dietary formulas really, as protective measures for people who are in wildfire country now, because now the West Coast has fire season. And so if we know that's coming, we can recommend all of our patients start taking something to create a protective layer so that fire season doesn't cause a problem for them. Okay. Sorry, little bit of a tangent there, but these are important questions. So thank you. Okay, yeah, you're welcome. All right, next herb. We're gonna go a little bit quicker here. Zhuai Mingzi, Cassier semen. I'm going to remind you that the last word in most of these names in pinyin tells you which part of the plant this is. The means seed. So it also tends to mean that the end word is going to be semen. Just helping to remember these things helps with herb ID. You know, if the last word's hua, it's going to be a flower, so you're not going to put that if you see a seed. Bitter, sweet, salty, slightly cold, going to the liver, large intestine, and kidney. I think this is the first time we're seeing kidney here. Let's get away from Bensky because I'm just going to go into too much detail. I mean, I'd love going into detail, but we don't have the time to do it for every herb. Okay. There we go. Lugum's great. Tianhua Fun's great. Oh, sorry. One more thing with Tianhua Fun. You traditionally do not combine it with Fuzi. There's no real reason you would combine it with Fuzi, but the traditional contraindications are things that they like asking questions about, which means I like asking questions about them. I don't like it, but I will. So just know that. And yeah, I guess joining is our last one in this category. Slightly cold, bitter, sweet, salty, liver, large intestine, kidneys, clears the livers and the eye, clears the liver and the eyes, calms the liver, anchors errant yang. Seeds tend to be heavy. Seeds tend to move down. They're often going to have some degree of an anchoring or downward draining or moistening the intestine and unblocking the bowel's function. If you're given 3 herbs that you don't know at all, one ends with hua, one ends with the, and one ends with zhi, which is usually ramulus, like in guizhi, and they ask you which one unblocks the bowels, 9 times out of 10, you're going to be right just putting the seed. That's because seeds are oily. That's the main thing that's happening here with this moistening the intestines and unblocking the bowels. You're saying you're going to drink a hot, mildly oily substance like coffee, and it's going to help to move the bowels. That's the main thing they're saying. This is another blood pressure herb. And again, it's going to work the best if it's due to liver heat. That's the main time we're going to be using it. What about this whole errant yang thing? That one's a little bit of an outlier in this. The errant yang aspect, the errant yang aspect is mainly about yang rising due to yin deficiency, which I think is part of why the kidney's here as well. Not positive about why the kidney's here. It has a draining, downward directing, anchoring effect. So it makes sense that we use it for high blood pressure, but we're also going to use it for things like people getting headaches at night before going to bed, or people who get angry in the evenings. This is an herb that we sometimes use for menopause when it comes with floating yang symptoms. So menopause with floaters in the eyes and tinnitus and a red face and a tendency to yell, for example. Let's see here, is there anything else worth noting? It's a big herb for the eyes. We're going to use this one a lot for the eyes. This is not a chief. This is not a major herb. This is an herb that shows up in like 9 to 12 grams in a ton of formulas that do these things, but it's not the chief. It comes in to add a little bit of its own flavor, just as most of the herbs towards the end of chapters do. Okay, let's take 5 minutes. We're gonna just shake it off, and we're gonna do a couple of clear heat, cool blood herbs, and then we'll stop for the night. Sound good? Okay. I'll be around if people have questions, so feel free to ask them, but otherwise you're all free until, let's just call it 8 o'clock. Come back at 8. We'll do another 20 minutes or so, and we'll be done for the night.
Peter, I just have a question about the next section we're going to do. Right now, we're in, what section is this? This is clears heat, removes toxicity, right?
We just did clear heat, drain fire.
Sorry, I scrolled up too far. Okay, clear heat, drain. So now we're moving into.
So we've got a bunch of small chapters, and I think we can basically knock out herbs that cool the blood, because I think we've got 5 herbs in that. So like maybe we'll get through 3 of them now. And then the clear heat resolve toxicity is a very long chapter.
Okay.
Very long section. So that's gonna be a whole day, maybe 2.
Okay.
As far as I can tell, we're a little bit ahead of schedule. So
Okay, because on the
Ignore the Moodle, because that's for 3-hour days.
Okay, no, I'm not in the Moodle. I have the form, the Microsoft Word document of like all of the lectures, all of the vocabulary. So
yeah.
How it's, I guess, ordered, like the last one we just were on is in the clear, heat, drain, fire, right? But then after that, it goes to clears heat and resolves toxicity. I just want to make
let me look at this document. It's not like I wrote it or anything. I should know how this goes.
Yeah, the ordering was cool blood before the section we just did. So we just did those in inverse order.
Okay,
so we're going to be going a little bit out of order. Yeah.
So go up.
Yeah. And I'll just move this now in my document so that it's correct for next semester. Yeah, so it really should be the clear, heat, drain, fire, and then clear, heat, cool blood. Okay. In that document.
Okay, Jared, do you have that document open? What page are you on? I'm just curious because I feel like I'm like fishing through here.
I mean, I'm like having my own methods of like pulling it into their own sections from the main document.
You're doing something.
But
it's under like a resource on the Moodle.
Oh no, I have the document. I just am trying to figure out what page number should I.
No. Like it's Peter's set up where it's divided by category.
Okay.
What's it called? I think it's general course information, and then resources, and then it has a date, and it has like just the clear heat, cool blood, and then clear heat.
Nicole says page 66.
Thank you, Sonmi, and then thanks, Nicole. All right, thanks.
So if it's not apparent at this point, it should become more apparent once we start doing the clear heat toxicity that we have a lot of
You're breaking up, Peter.
Yeah, I think you're too far from your computer or something.
Fair enough.
The Bluetooth couldn't handle the distance, so you got robotic.
So it should be starting to become clear that we have a lot of herbs that kind of do certain things. So like a bunch of herbs that will treat hypertension, a bunch of herbs that work for diabetes, and then the artistry, like the making really good formulas, involves picking which ones are the right ones based on the pattern, based on the person's condition, and getting really specific. And that's the hard part. Making a list of like all of these herbs treat hypertension is just not, it's a good thing to know, but it's not very helpful because they do it for different reasons, and therefore they'll work better or worse for different people.
You know, it seems like you kind of you've fallen in love with certain herbs. And is that because you've tried them more, or you've, like, I'm trying to figure out, how did you find your way to the herbs that you like really, really are tried and true for you?
I mean, some of them just, I've got herbs that I love, and that's very separate from formulas that I love. I've got formulas that I love where I don't really resonate with any of the individual herbs that are in them, where I find the herbs boring, but they come together and do something interesting. I tend to really like herbs that, to me, God, how do I explain this? That do something. Some herbs have functions that make me excited, or have a, I've realized I've never tried to explain this.
Good question, yay.
Yeah, good question. I think some herbs' functions are beautiful. Beautiful in like a harmonious way, or in a, I'm impressed by some of the herbs, by what they can do with our systems. And when that happens, and in addition to that, I've enjoyed handling them, or I like their smell, or they've got a terrible smell, which can be fun too, or same thing with the taste. There's personal resonance that shows up with these things. Yeah, I don't really know how to explain it. Some of them have just gotten great results. Some of them are just like, there's something magical about this one, like futza, where like, I don't like most of that. Like, I don't really like holding it. I certainly don't like drinking it. It's very inappropriate for me. But but when I've used it, it's just been magical. So I'm like, this gets a special category. Like, I think I've already mentioned this to some of you. I had a patient who was severely asthmatic and using their rescue inhaler like 7 times a day, and really like edematous, overweight, and we put her, and her asthma was a kidney not grasping the qi type of asthma, and Futsa works for that if you dose high enough. And so we dosed her very high at about 25 grams a day of Futsa, which I think Bensky's highest recommended dosage is 4.5 grams of Futsa. And in a week, she'd lost 15 pounds and had stopped using her inhaler altogether. And we got her completely off the formula in 3 weeks, and she didn't use her inhaler for the next 6 months that I followed up with her. Not only her rescue inhaler, she didn't use her normal inhaler.
Wow.
Her asthma went away, and it stayed gone. And she lost a ton of weight that she was carrying because her fluid metabolism was wrong. She lost the edema, all of that.
Wow.
That's awesome.
She was in her early 30s, and she'd also been trying to get pregnant for a while. And about 6 months later, she got pregnant spontaneously, which Futsa helps with that too, for some people.
Wow.
So after those sorts of experiences, it's like, I can't help but love this herb. And then there are others that are just more personal. There's something about Lugun that tickles me. I don't really know why. I like it.
Yeah. It's like people. Yeah, it makes sense.
Yeah. Okay. Welcome back, everybody. Let's dive into the clear heat, cool blood category. Is there anything I have to say up front about this? I don't think so. Yeah, I guess there's a couple things to say up front. So let's share Bensky. So in the clear heat, cool blood section, these herbs are primarily cold, bitter, and then they're pretty much all bitter, and then they're sweet or salty. So sweet or salty is going to be generally more tonifying or more draining. They're pretty much all going to be bitter though. We use them for yin and shui level disorders in the Wending. So once the person has heat deep enough in their system that we're worried about bleeding or neurological damage. So when we say bleeding, we include things like strokes or throwing a clot as potential things that could happen. Why are these herbs that cool the blood as opposed to herbs in other chapters that also happen to cool the blood? These herbs we use specifically for heat in the blood, mostly as chiefs and deputies, in part because they don't also injure the blood. Some herbs that are bitter and drain heat will damage the blood as they do it. If you've got a lot of heat in the blood, we don't care that much about damaging the blood because you just need to get that heat out of the blood, but it's better not to if you can help it, and these tend not to damage the blood. Sometimes we use these for yin deficiency if they've got yin deficiency with fire, but not that often. Our first herb, Shui Niu Jiao, is the water buffalo horn. Sustainably harvest, the water buffaloes are fine and happy. This herb is ethical as long as you're comfortable with any animal products. This is not the herb that was classically used. This herb is a replacement for rhinoceros horn. All those things about rhinoceros horns being harvested for Chinese medicine, this is what we're talking about traditionally. These days, rhinoceros horn is a much more complicated product in Chinese culture because it's taken on a status symbol quality, because rhinoceros horns were something that families would keep and hoard because, yeah, my understanding is the water buffaloes shed horns like deer shed antlers, yeah. But I think we'll talk about harvesting in a minute. Most of the use of rhinoceros horn these days is as a collectible item that shows that you're not new money, that shows that you've got class and taste. That's the main thing that rhinoceros horns are used for these days. Because rhinoceros horns were something that could be kept for a long time without going bad, these would be in the vaults of the wealthy families of China back in the day. It's not like they were easy to get on demand either. So these days, it's mostly a wealth and status symbol thing. And when we're actually talking about medicine, we use water buffalo horn. The way most of these are harvested, same way that we harvest deer antlers these days, is the animals are passed through like a funnel. The animals walk down a line, and there are wires that are superheated that cut through and cauterize the bones. We don't want to wait till they fall off because we actually want the blood to still be in them because they have active blood vessels in them. Doesn't hurt the animals. They do this year after year. The water buffaloes just go back to work. That's my understanding. I've never harvested a water buffalo horn, so I'm not positive about all of that. That's just what I've been told. My understanding is that this is not something we have ethical concerns about. There are other herbs we have ethical concerns about. This isn't really one of them. I don't hear people being concerned about this ethically. Salty and cold. Pretty much all animal products are salty. Keep that in mind. It goes to the heart, the liver, and the stomach. Jonathan's got some there.
In the kit that doesn't look like a buffalo horn. That looked like, I don't know, like a herb or something.
Yeah. So what they do with the buffalo horn is they take it and they shave it paper thin. So you end up with these little paper thin shavings of it because you want the largest possible surface area of this herb. It's not an expensive herb, but it's not cheap. And a lot of the ways that herbs are prepared are to maximize their surface area without creating a powder that you have to drink. So this is what they do with the shui gel. They do that. That's part of the reason you see this dosage range here. If you're boiling it as those strips, you have to use a lot. If you're actually going to drink it, if you're going to keep the powder in, then you can use less. We use it for yin and shui level heat, heart, liver, stomach, that's what you'd expect, and to help with bleeding due to heat. This herb's cold, but it's not really cold in a way that we're too worried about, because at this point, we don't care about their spleen and stomach very much. If they've got heat in the blood to the degree that we're using a large dose of water buffalo horn, if they get diarrhea for a few days, that's the least of our concerns. If they have trouble producing postnatal qi, we're just not that worried because we're trying to treat something that might cause them to suddenly die. In general, we don't use this herb unless they've already gone to a doctor and been discharged and are not getting the results we're hoping for. We may use this sometimes as a adjunctive supportive therapy for things like cancer, where the chemotherapy itself produces heat in the blood. So we might use this at lower doses to prevent the heat in the blood caused by chemotherapy that can lead to problems down the road. So clears heat, resolves fire toxicity, cools the blood. We are concerned about, so we're talking about warm heat pathogens, we're talking about Wenbing, so Wei, Qi, Ying, Shui, the 4 levels. We're worried about the Ying level and the Shui level. Those are the things where there's danger. And sometimes I don't like how Bensky words things because you have to understand the language. We're concerned about very high fever with chaotic movement of hot blood. That's his way of saying spontaneous bleeding due to heat, which is another way of saying we're worried they're going to have a stroke, a hemorrhagic stroke. This patient might be the sort of hypertensive patient who gets regular nosebleeds due to their high blood pressure. They might regularly get popped blood vessels in the eyes. They might have bleeding gums. If this is a woman, she might have extremely heavy menstrual periods. They might have rashes that show up that are just erythema, it's just bleeding under the skin. All of these are signs that they might have this heat in the blood. You also might see mental changes. Once you get heat in the blood in this sort of fever, people get weird. If this patient is older and is also somewhat deficient, then we might be using this for heat in the blood causing wind. So older patients with heat in the blood who begin developing tremors. This is less of an emergency condition, though it certainly can be an emergency condition. Like they're listing things here like unremitting high fever with loss of consciousness, delirium, convulsions, or manic behavior. What do we do with that patient? We call 911. Where do we use this for tremors? Patients who are old, on chemo potentially, and developing things like Parkinson's, or other tremors and tics, that's where we begin to consider using this. Worth reading a little bit about it here. I mean, they're saying here it's not just a modern substitute for rhinoceros horn, it's other things as well, and that's true. In the, well, I guess I can just open this up. If we come down here to the obsolete substances category, which contains things like mercury sulfate, which we don't use anymore, we can go further and come over to the endangered animals category. And do I not have this in here? I could have sworn rhinoceros horn was in the back. Okay, never mind. They don't have it in here. I must have read about it somewhere else. It's worth it to read up on rhinoceros horn at some point. It's kind of interesting, but it's not particularly relevant here, so we'll keep moving. All right, let's 10 more minutes and we'll stop right here. Okay, let's just get through maybe 2 more of these. Shangdi Huang. Shangdi Huang and Shudi Huang are almost the same herb. Well, they are the same herb, they're just prepared differently. Normally, when we have 2 different preparations of an herb, we give the general herb, and then in the preparation section further on in Bensky, we talk about the other versions of it. This herb is so different in its 2 forms that it's just 2 herbs. If you look back at some of the classic texts, they just say Di Huang. And you've got to figure out from context whether it was prepared or not. But we use both options so frequently that we've decided to call one sheng. If you see the prefix sheng, does anyone here know what sheng means? Shengjiang would be another sheng herb.
Charred?
Hmm?
Charred?
It means almost the opposite. It means raw or fresh. So it means unprocessed, right? So Shengjiang is fresh ginger, and then Gangjiang is dried ginger. Shangdi Huang is the fresh Romania root, and the Shudi Huang is, I believe, wine aged. I think also with ginger. Wine steamed, thank you. This is a favorite herb for comprehensive exams to make you ID, because they both look like little hockey pucks. So test them both out in your herb kit and try to feel the difference. There's a difference in how flexible and bendy they are, and if you tear them in half, there's a difference in the color on the inside. Those are the ways that we usually tell the difference. Sweet, so Shangdi Huang is a cool blood herb. Shudi Huang is a tone high yin herb. This herb, this Romania radix, sweet, bitter, and cold, goes to the heart, liver, and kidneys. These 2 versions of it are going to have some overlapping function. Being the same plant, no matter what you do to it, it retains some of its nature. In this case, clears, heat, and cools the blood is the first function, but it also nourishes the yin and generates fluids. This makes this a very popular herb for people who have heat in the blood with yin deficiency at the same time. I mentioned with Shui Niu Jiao that we might use it for tremors in an older person with some heat in the blood who's developing something like Parkinson's. Shangdi Huang we're going to use for an older person with heat in the blood with a lack of fluids and yin damage. So this makes this a very good herb for menopausal women who have a lot of dryness.
Peter, did you just say that heat in the blood is related to Parkinson's?
Heat in the blood is one of the types of Parkinson's that we have. Heat in the blood can cause wind.
Oh.
As the heat stirs the blood, it can cause wind to come up, and so you begin getting the pill rolling action with the thumb. It can also be things like a patient that starts developing facial tics, twitch in their face, or like twitching in the eyes. Yeah, okay. Those can be heat in the blood.
Thanks.
Yeah. So we're going to often, if we're using Shangdi Huang for this first function of clearing heat and cooling the blood, we're pretty much using all the herbs from this category simultaneously to do that. If we're using Shui Niu Jiao as like in large doses for its function, we're pretty much throwing the kitchen sink at that patient. And so, in fact, the name of the formula we're often going to be using in that case is Shijiao Di Huang Tang, which is just a portmanteau of Shui Niu Jiao and Shangdi Huang. The two things mashed together. Don't worry about memorizing formulas right now. I'm just pointing them out as we go through, but don't worry about it. You got enough. Nourishes being generates fluids. So we're going to be nourishing those fluids in some cases for diabetes as well. So that's saying yin deficiency, lack of fluids. In this case, though, we're going to be using it for diabetes due to kidney insufficiency. Earlier, we were talking about herbs that we can use for diabetes when it's stomach and lung related. Here, it's kidneys. If it's kidneys, you also see stomach and lung symptoms. The kidneys rest under everything else and support our entire structure. So if the kidneys go, the thing above it goes as well. But with kidneys, you're also going to see symptoms of aging, low back pain, knee pain, potentially heat signs at night from the insufficiency, along with diabetes. So patients who do things like sweat a lot at night and get hot flashes at night, or even patients who might get like some itching on the skin, or like as the sweat happens and the lack of yin becomes more prominent, these heat signs and the sweat appears on the skin, we might consider something like Shangdi Huang to help cool them down. This is another good one to read through just because we use this in multiple different places. There is a note that's worth reading. The Di Huang herbs, the Nemarene herbs, are hard to digest. When we think of a cloying, difficult to digest herb, there are two that come to my mind, Shangdi Huang and Jiao, which is literally goat gelatin hardened into a blob. Those are the two herbs I think of as, yeah, those are really hard to digest. Shangdi Huang is not as hard to digest as Shangdi Huang, but it is hard to digest. And so we often add as a corrective assistant into formulas, food stagnation herbs like Sha Ren to help them digest. So just file it away in the back of your head, might be an extra credit question. If you need to give a patient a formula that's going to be too hard for them to digest, what might you consider adding? Herbs that help digestion. Okay, skipped Mudon P. Did I skip? Oh, okay, interesting order. Our next herb is Xuanshen, Scrophulariae radix. Kidney, lung, stomach. So we're looking at all three of the places that we often get concerned about diabetes, which would make you think this must be an herb for diabetes, yet it isn't really, which is kind of interesting. Enriches the yin, I mean, it is a little, but not too much. Enriches the yin, moistens dryness, drains fire, resolves toxicity, softens hardness, transforms slime heat. That's a lot of things all at once. We can use it to cool the blood, just as in the other herbs we've talked about so far in this category. Really, basically the same mechanism of action. In this case, it's especially true if a lot of that heat is showing up in the stomach, but that distinction is not wildly important. It's going to nourish the yin. This part is more important. This is an herb that we add in. So if you have a lot of heat in your system, if you have heat in the yin level and the shui level, it is going to damage the person's yin and fluids, almost guaranteed. Depends how long it's been there, but pretty much guaranteed. So some of our herbs are mostly there to attack the heat and get that heat out of the person's system. Some of our herbs are there to kind of attack the heat, but also to nourish and support the yin. And this one is right in between. So we're going to use Xuanshen with Shui Niu Jiao and Shangdi Huang as a way to support the yin. We're also going to continue using Xuanshen after they're better to make sure nothing comes back as we're healing the yin. if you want a way to remember the Latin for this, Scrofulariae radix, this herb treats scrofula, lumps in the throat and neck. But it has to be due to phlegm fire. And this is where we see the lung aspect of this. This will dissolve nodules related to phlegm fire in the lungs. You may not have really heard about phlegm fire as a disorder yet. Just think really hot and a lot of phlegm mixing together in the worst possible way. That's phlegm fire. So if someone smoked for a very long period of time and begins getting bumps and nodules anywhere around here, this is an herb to consider. I would think, but don't have personal experience with, so this is just conjecture, that this would be a really good herb for any sort of cysts forming in the lungs or the throat due to phlegm heat as well. If I get a patient who has that, this might come into play in the formulas that I would use. But I'd also sit down and do some research with that. Did you guys learn Ma Bo in Intro to Herbs? I think you learned Ba Do, but did you learn Ma Bo?
I think so.
Okay, so it's the fruiting body of this mushroom that's used for all sorts of throat swelling and pain in the throat. It's kind of like Chan Tui, except for lung fire. So Chan Tui is for like a wind heat, so the person suddenly gets sick, sweating, and begins losing their voice. This is more for someone who's a long-term smoker who begins losing their voice. And we're going to combine that with Shuan Shen. That's about it for this herb. It's an interesting herb. It's fairly clear how it's used most of the time. Let me make sure I'm following this correctly. Yeah, we got 2 more herbs in this category, but how are you all doing on energy level? Do you need to go? Can I get 10 more minutes out of you? I'm seeing some people having a rough time here.
Yes.
Okay, I think we're stopping here for tonight, everybody. We're doing great. We're on our schedule. Ignore what the Moodle says because it's for a 10-week version of this class and we're doing the whole semester. We're doing good. So next week, you will have an exam, as you will have almost every week. Next week will be on clear, heat, drain, fire herbs. So that would be this list. Some of the stuff we covered last week, so make sure you're refreshing that memory. Some of it we covered this week, and again, 20% of it's going to be reviewed. So there are going to be a couple questions from earlier in the semester.
Peter?
Yeah.
When is the midterm again? Is it the 15th?
That sounds right. Let me pull up the syllabus. There we go. Make sure I got this right. Yes, the midterm's on the 15th. So next week, we are going to have a quiz. We're going to finish the chapter we're on now. And we're going to try to do most of clear, heat, dry, damp. And if we do that, we are pretty much right on for the midterm. A little bit behind. That's okay. We're doing good. We're just going to be a little bit behind. That's all right. We've got to catch up. Okay, so review all this stuff. Next week, clear, heat, dry, damp, and finish off clear, heat, cool, blood. And then we'll review for the midterm. I will write up, well, I mean, you guys are getting examples of these quizzes, but I will send out, yeah, I can do that. I'll send out the quiz questions you've gotten so far so you can look at them for the midterm, stylistic reminders. And then the midterm is just going to be if I'm giving you 15 minutes for these, I'm going to give you an hour and a half for the midterm.
Sorry, you said clear, heat, dry, damp.
Yeah.
On that resources page, it says, sorry, I just lost it now. It says that's later, but is it sooner rather than later now?
I'm going to toss the current syllabus up right into the chat right here, so you can take a look at it there. And here, let me go one step further with that. here's our syllabus. We have deviated. We've skipped over the clear heat from deficiency herbs for now. Next week, we're going to finish off herbs that cool blood, Mudam Pi and Zutsao. And then we're going to get as far through this as we can.
Oh, okay.
And then we're going to review for the midterm, and then we're going to have the midterm.
Okay. Are you going to give us our quizzes back next week?
Yes.
Okay.
And I'll give you the raw quizzes so you have something to look at and study from. This makes sense to people? You with me on this?
I'm not totally understanding. So for this day, we need to, for now until next week, we need to study clear heat, dry, damp herbs.
For next week, for the quiz, you need to study herbs that drain fire.
That drain
We
fire.
just finished today. So that was Shigao through Zui Mingzi. That's Lu Gun, that's Tianhua Fun, the herbs that we just covered that are good for diabetes and smokers. This is the quiz for next week. Just there. Got it highlighted here. Next week, we're going to finish the herbs that cool blood, and we're going to see how far we get into clear heat, dry, damp. And then however far we get, that's where we're going to stop on the midterm. And then we'll review the midterm, and we'll go right into it the next week. And then we'll take the clear heat from deficiency, and that'll be the first thing we do after the midterm. Then we'll get into clear heat from toxicity, which we have 2 weeks for. And then it's fairly smooth sailing. Yeah. Does this make sense? Are you with me now?
Yeah.
Everybody with me? Great. Okay. You're all released. Thank you for coming. I'll hang out for a little while, answer any questions. Keep talking on the Slack. I like some of the conversations I'm seeing on there. I had some stuff about dandelion that I'm going to put up later on there.
Thank you.
You're all free to go, though.
Bye.
Thank you all. Good
Thank
class.
you.
A lot of
Thank
info.
you.
Good luck studying.
Dr. Karen, it's Marianne.
Hey, Marianne.
Hi, I have an inquiry that maybe you might know about. I have a plant. I have a bunch of plants that are grown in my yard, actually in my one of my veggie boxes that I didn't plant. Do you know anything about American black nightshade?
I do not.
Oh, okay.
Yeah, my Western herbal knowledge is very limited. I've taken a few classes, but because the entire conceptual system around it is completely different, my Chinese herbal knowledge, if anything, makes it harder to learn Western herbology rather than easier, because you think about them so differently. There's a whole bunch of books that talk about Western herbs in Chinese language, but when I talk to people who kind of do both, they're like, yeah, they're okay, but, and really, we've got enough herbs in Chinese medicine. But if you have that growing, that's cool.
No, well, it's kind of funny. Actually, can you see this? Actually, I don't know how clear it is. It was a video I took. I didn't plant it. What I planted there was, I don't know how clear that is or not. But anyway, I did a plant identification, and the only thing I could think of is I planted okra. They never grew. And then that grew in its place. I just think the birds harvested my okra seeds, and then they pooped their whatever, their breakfast, and now I have all of these plants. And the only thing, did you ever see Hunger Games? I don't know. Nothing.
Sure, yeah.
I kind of looked at them and was like, I don't know if I really want to eat these, but I did have a friend come over and try them, and she's still alive, so I think that's fine. But I didn't know if you knew anything about it because I didn't plant them. And
yeah, I mean, I would generally not recommend that as a technique for figuring out whether or not herbs are safe.
No, I didn't.
But yeah, I don't have anything else to share. Sorry.
Okay, no problem. Thank you, though. Have a good night.
You too.
Thank you.
Hey, Peter.
Hey, Jarrett.
I want to ask you if you had any like other interesting cases that you're treating currently that you'd want to share. I've kind of just started. So, I mean, I've been working in this space for under 2 months now. So I'm really just getting to the point that I'm starting to seriously prescribe herbs to people. I've got a bunch of interesting cases. I've got some not so interesting cases, which are like, you can't have all interesting cases. It'll drive you crazy. It has to be a balance. Totally.
I've got one patient I'm really excited to see what happens. he drove across the country recently in like a moving van and spent like the better part of 15 days sitting and driving. And he's developed a right hip problem. And that seems to be, it's like a nerve pain sort of a thing. I'm usually pretty good at treating those things. So I used all of the normal acupuncture stuff I would do to treat that and got all of the results I expected to get, except the pain didn't go away. So all of the muscles released, all this tension is gone, and all of a sudden I'm like, that's what I have for this, and it didn't work. I referred him to a chiropractor that I like. Chiropractor adjusted everything, and the chiropractor was like, got exactly what I was looking for. This is great, except the pain didn't go away. So now I'm trying herbal medicine with him. And I'm excited to see how that works because we're using one of my favorite herbal formulas for orthopedics, which is Du Huo Ji Shen Tong. I think you learned Du Huo in Intro to Herbs. But I haven't used it on someone with nerve pain. I've used it on people with damage to their lower limbs. I used it briefly for myself for helping to heal this injury. It's like 2 hours after drinking it and my knee pain is gone. It's like quite impressively rapid. But yeah, it's going to be interesting to see. So I'm looking to monitor that. Most of the others are interesting psych cases, but not herbal stuff.
It's like getting at the nerve level. That's like, that's got to be trickier, right? In terms of like how you're directing that, or, you know, I guess penetrating into that, typical to like just bone or muscle, which is kind of more, I guess, clear cut from at least the framework standpoint, right?
Yeah, I mean, well, nerve problems are related to the liver in general. Like moving pains, that's going to be a wind sort of a thing a lot of the time. Lack of control or spasms in the muscles, that's often wood. So I don't necessarily find working with nerve problems to be more, depending on what they are, but they're not necessarily more challenging. But this formula, I'm just going to be curious to see how it works. I don't think I've ever really used this in its raw form, and it is flavorful. So we're going to see how this works for him on that level. Yeah, it'll be interesting. It's my assumption at this point is because what I did didn't really work, despite it looking like it should be working. And what the chiropractor I know is a good chiropractor didn't work, despite it looking like it should have. I think he's got underlying deficiency. So if a patient has blood stagnation or qi stagnation, but underneath that they're deficient, you can move the qi and blood stagnation, but it'll just come back. Because
it has no sticking power. Yeah, there's no flow happening.
Yeah, good memory. And Du Huo Ji Shen Tong tonifies the kidneys and the liver, in addition to moving all this stuff. So if I'm right that it's deficiency, then it should address the branch almost immediately and slowly also address the root. So I'm excited. I just gave him the herbs today. So I'm excited to see what happens next week with him. Yeah, should be good.
It's like no joke of a formula. It's like quite a list of herbs, you know?
Yeah.
You have like some formulas that are like just 3 herbs. This one's like, no, we're coming to play here.
Yeah, I mean, like number of herbs in a formula doesn't tell you a ton about. A lot of times, a lot of herbs means a sloppy formula. Like my general rule of thumb is that if I wrote a formula with more than 10 herbs in it, I've probably gotten lazy at some point there. But this one's, everything's fairly required, and actually added a little bit of rogue way to it as well. So yeah, we're gonna see how it goes. Should be interesting. Happy to fill you in after I see him next time.
Yeah, I'd like to know. Cool.
Yeah.
Thanks, Peter.
Yeah, have a good night, Jarrett.
You too. Take care.
Bye.